start on my end, so we're all good.
Okay. Oh, there's a bit of a lag. Oh, there. It's not like it's live, but with a lag.
Yeah, Gary, you ready to start?
Yeah. Is it okay that there's a lag?
I think it's just the delay, because, this will be the best, and then when everyone else sees it, there's like 3 seconds.
It'll be delayed for them.
Are you ready?
Okay. Yeah, yeah.
Alright, green light. Sounds good. Perfect, will do. Alright.
It says live. Is it actually?
We are live, Gary. Good
Okay.
to go.
Welcome to live chat. All right. Okay. Hi, one epic line. How's it going? I haven't done this in a while. Oh man, A Millie with a question. How long after a hair transplant can you go back to the gym? I usually tell people 2 weeks for most gym activities, 3 weeks for like sauna, swimming, that kind of thing. Please do a video on Maya Goth. I don't know who that is, but we'll check it out. Insert ads. What? It says like we can insert ads. Okay. I don't know how to do that, so we won't do that. We won't do that to you guys. Hey everyone. Hey Ikram Tis. Hi Jacqueline. Thank you for the support. Please do a video on Cher's plastic surgery. That'll take a while to prep, but yeah, we'll get there. Hello, Uzoma. Sebastian, how much does an eyelid surgery cost? It depends where you go, man. It depends where in the world, where in the country, which city, which doctor. There's so many factors. And also, if you're getting the upper eyelids done, lower eyelids. I've moved away from those surgeries. I sort of refer out for most of those now. But, it just depends. It can cost you anywhere from, I don't really know anyone who charges less than like 3,000 for like upper eyelids, upper bleph, lower eyelids usually at no less than 5,000, and then it can go up to like 15, $20,000 plus per upper and or lower eyelid. So depends. There's a wide range. Hi Kate from Sweden. All right, I've been told before that I spend too much time trying to read every question and then I don't get to the bottom, so I'm gonna do better scrolling down. Um, Best skincare after 60. Truth matters. Hang tight. We're going to be releasing more videos about skincare. We are formulating our own products from scratch. So you'll be hearing a lot more about that in the coming months, and we'll make videos around that. Is there a difference between a maturing hairline and a widow's peak? Well, yeah, widow's peak someone can have without a receding hairline. So you can have a very youthful looking hairline and still have a little bit of a widow's peak. That's just where the central part of the hairline comes down and in a little bit. So that can be part of a mature hairline, but it can also be just part of a regular hairline that happens to have widow's peak. Now with surgery, some people ask me to recreate the widow's peak, and other people are happy to get rid of their widow's peak in a way. So it depends. Okay, let's see. Hope, what are your thoughts on PRP? Only after hair transplant, no finasteride for 25-year-old. My doctor only advised PRP. Remember, PRP is not something that's going to prevent further hair loss, right? It can be seen as like a stimulant, kind of like minoxidil, and it should not be seen as truly preventative from further hair loss like finasteride is. So I don't think it's a great idea at age 25 for most people to get a hair transplant if they're not strongly at least considering finasteride. Remember, if you have a side effect from finasteride at the classic standard dose of 1 milligram, you can always try a lower dose, spaced out more often. And you can also come down to a topical formulation, but we don't start with topical because it's less effective. But to get a hair transplant in your 20s, and not at least strongly consider finasteride is, I don't think, the best approach for most people. For most people. Mariam, thank you so much. Let me see what else we got here. Archivez, you can make your live comments in slow mode if you'd like to answer all the questions and not get too overwhelmed. Yeah, but then I'd have to be doing this live for like hours, you know? So maybe one day I'll do a long live session, but the way that my days and weeks are structured, it's hard for me to find like a massive block of time to do like I don't know, a really long stream, like I guess like someone on Twitch or some gamers do. I have like sort of a different lifestyle between my clinical practice and my family, and all the demands from YouTube. So it's different. But thank you for the advice on slowing things down. Well, we can look into that. So okay, so what else we've got? 1 second. Okay, a lot of comments coming in. How many people are in this chat? Do we know? Oh, current viewers 135. Chat rate. Wow, there's like all these analytics that are here. Okay. Yanil, how long do implants with the lift last? Mine are with saline and silicone. So it sounds like you're asking about breast implants. That's not my forte, so I'm gonna pass on that question. There are great body plastics people. And actually, something that you'll see a very new version of our Feel Confident website. If you haven't checked it out, feelconfident.com is like our new product brand site. But what I'm including as part of that, you'll see it in the header, it's going to be like beauty experts tab. And essentially, the idea that was given to me was like incorporating a Michelin star approach, where we don't give like 1, 2, or 3 stars. It's going to be like whether you either have it or you don't. And it's going to be for specific things. So a specialist, let's say, who's a plastic surgeon, but mainly does breast surgery, if they're really good and they have great results and they're known for that type of surgery, they'll get a designation as like, specifically a breast surgery expert. And that's going to be visible to people. So it'll be specialists from, around the country, around the world eventually. And my idea is to expand beyond just plastic surgery into a lot of other types of aesthetic fields. And yeah, so you'll see that. So for example, if you're looking for a great breast surgeon, breast augmentation surgeon, let's say, you can go and find someone on our sort of trusted list, and no one will be able to pay to get like the star, right? Just like Michelin, it's going to be a more kind of a honest, kind of authentic process to get the designation. And so we'll see where that takes us, because a lot of people call in and they email us and they ask, where do I go for this? I'm in so-and-so country, I want to get a hair transplant, I can't fly to you, where do I go? Same thing with other types of surgeries that either I never did or I no longer do. So we want to have like a really solid, trusted list of providers for people. And there'll be nurses too who say do injectables, things like that as well. Okay, Ikram, what is your opinion on a no scar lip lift? Where is a site called PubMed talking about it? Well, PubMed is like what we use to compile all like the world's literature. So that's like scientific literature. So that's a very, a big site. But in terms of my opinion, there's no such thing as a good no scar lip lift. Any scar that's hidden fully inside the nose is not going to lead to the most optimal lip lift result. And just using like threads and not having a scar and just kind of pulling, that's very temporary. It's not a good long-term result. Okay, so Cindy, are big pores your friend or your enemy? I guess it depends on the person, and if they mind their pores. Most people don't like big pores, so I don't foresee it being a friend for many. But I know that we've been thinking about doing more skincare related videos. Let us know if you want to see more of those, and expanding into topics like melasma and pores and things that aren't fully like plastic surgery per se, but are a little bit more skin relevant. We did that video recently on sunscreens, comparing a cheaper one to a more expensive one. Most people seem to enjoy it. Daniel is asking, is it possible to substitute finasteride pills with injectable dutasteride? It is possible, and most people do like oral dutasteride if they're gonna bump up. I think of dutasteride as bumping up too, because finasteride is the less potent cousin, and most people do quite well on finasteride and don't need to switch to dutasteride. Remember, dutasteride is much stronger than finasteride and carries double the side effect incidence. So you got to be careful with that. Um, so let's see. Who else do we have here? Okay, so I answered Daniel. Okay, thank you. All right, let me keep going. What's with all these red stop signs? BNYC. Do you treat hair loss due to PCOS? If so, which methods do you suggest? So, there's different causes of hair loss, and we definitely treat all types of, hair loss conditions, except for, I would say, autoimmune. So, like if you have androgenic, if you have alopecia areata, like me, then we don't usually treat that with like the medications that people normally prescribe nowadays, such as the JAK inhibitors. That's not the focus of my practice. So we refer out to dermatology. Most other hair loss types we do treat, and there's different strategies. So give us a call for non-surgical hair restoration. You'll talk to one of my either my nurse or my PA, who specialize in non-surgical. And then if there's surgery indicated, then either if you feel like you're a good surgical candidate, then you'll talk to me. If you talk to a nurse or PA and they say, hey, surgery might be a useful modality here, then you'll kind of get bumped up to talking to me anyway. But that's how we work it in the practice currently. Kevin wants to know, can you use nape hair for hairline transplants? The problem with nape hair is that it's very fine. So that's the first issue. The second issue is that the scars are more visible, because it's low down on the neck. So that's one of the other big issues. So the other thing is it's more susceptible to retrograde alopecia, retrograde androgenic alopecia over time. So you have to be careful about selecting those hairs primarily. Let's see. Let's try to find someone who hasn't asked a question before. Shirley, what is the born with double sexual appendages called? Hermaphrodite? It was like a quiz question. Let's see. Karthik, what is your opinion on using dermal roller, minoxidil, and low-level laser light caps all together? Would it be too much? I don't think it's necessarily too much. Usually we recommend 2 different medical modalities. So if you're doing dermal roller, or really it's microneedling, we recommend a stamping tool instead of a roller. Minoxidil, that's already 2, and now a laser light cap, that's 3 forms of medical therapy. That's all well and good. The issue is you have to consider, again, the preventative side of things. So strongly consider finasteride. Despite, the side effect profile, it's still overall very effective, and side effects are quite rare. Okay, hold on. Okay. AABB. I've lost a bit of ground since I started finasteride 4 months ago. Can't tell if it's shedding or recession. Is there any way to know? Well, you should talk to a hair specialist, someone who can track you over time and give you some advice on what to do next. Kate, which female and male celebrities do you think have the most attractive faces? Well, you get to my analysis pretty often now. We're going to try to do a celebrity analysis every week, to release one each week. So we're like bumping up the frequency, because it used to be that we're like, oh, let's do one now. And then maybe a month may have passed before, since the last one. But Margot Robbie was our most recent celebrity video analysis. So make sure to check out that video if you haven't watched it yet. And, the whole Barbie movie, all that. But I think, she definitely has a very attractive face. Our next one up is going to be Ryan Gosling. We filmed that video earlier today, and it should be up next week, probably on Sunday. Kevin again, how common is retrograde alopecia? There's variations on it, right? So it's like a spectrum. Some people get it really bad where it comes up quite high, and other people just have a little bit of it. But I would say, you know, overall incidence is probably at least 10-15%, and then maybe even more actually. And then some people have it like in a more extreme form. That's kind of rare, but yeah, it's not totally uncommon. All right, Fluffy Bunny. What price range can I expect for a hair transplant in Turkey or in general? I mean, in Turkey, you're probably going to spend, I don't know, anywhere from 2 to 3 thousand upwards to maybe 7 or 8 thousand if you go on the high end of things in Turkey. And then, just in terms of just anywhere, there are some places, like my clinic is definitely on the more expensive side of things when it comes to hair transplants. So you can spend upwards of, 25 plus $1,000 on a transplant. So it depends. Some places even charge more. From what I heard, it's like it can go up to 30,000. I've heard of even up to maybe 50,000. So yeah, I mean, these are full day surgeries that require an entire team. This is not like, for many hair transplants. And it can completely change like how people look. So it's a big deal. It's a much bigger deal, I think, than people want to give it credit for. I know some people charging $100,000 for a facelift starting price. So if you want to add in, eyelid surgery, a lip lift, a rhinoplasty, you're spending upwards of maybe $200,000. And this is, also that's another full day type of experience. But yeah, so I feel like hair transplants deserve more credit. And I think, yes, Turkey has brought down the price for many, and great, people want to go there. But everyone's got the right to charge whatever they want. It's supply and demand, right? That's at the end of the day how all this stuff works. Pricing of anything, right? Whether you're paying for a car or I don't know, some like toothbrush. It's all supply and demand. Okay, so lots of questions coming in. I'm doing my best, guys. I'll try to get an hour out of this, but sometimes I'll on your break sooner. But we'll see. Okay, Diggy? Diggy Nomad. Interesting name. My little cousin is experiencing alopecia areata. What can he do? His pattern are weird. What do you recommend? Should he do blood work? No, it's usually a diagnosis that is more pattern based, and sometimes there's a microscopic analysis, like like looking under the microscope, doing a biopsy. Sometimes there's usually not too much blood work linked to that. So what you want to do is find a dermatologist who specializes in alopecia areata treatment. And because now we have these JAK inhibitors, you may have heard of, like Olumiant. We have a video on this topic. So check out, put in alopecia areata and then our channel. You'll see that video, and it goes through. That's one of the recent FDA approved medications. There's another one that came out even more recently. But yeah, so consider that. Obviously every medication has its pros and cons, drawbacks, all that stuff. Side effects, you have to really consider it. But the first step is to get the proper diagnosis, and so you want to consult a specialist for that. Hi, Doc. Do you do chin reductions? This is coming from She's Come Undone. Do you do chin reductions? Do you think one should wait to get them? I'm 21. I mean, in general, when you're 21, you don't want to jump into getting surgery unless you really thought about it for a long time and you're like, this is what's been bothering me, for many years, and I want to do something about it, and I've really done my research and thought about pros and cons. I understand the risks of the surgery. That's the kind of approach you want to take. I don't do chin reductions. I've done only a few in the past that were skin only, but if you are looking for a chin reduction, you should try to find like an oral surgeon who happens to do chin reductions, because sometimes what you need is some of the bone actually reduced down, not just the skin. So keep that in mind. Just gonna drink some water. Okay, comments are flowing in. I don't know what is chat rate. It says chat rate 8. F. Austin, thoughts on stamoxidine for hair regrowth and in a stack with monotony? I'd have to look up stamoxidine. Honestly, Austin, that's not one that is commonly used or recommended. So I'll look into that. Today we filmed a video on the latest hair treatments in 2023. That video will probably come out in the next 2 weeks. So stay tuned for that because we cover Scoob 3 and osteopontin that you guys have been asking about for some time. And sorry, just haven't had a chance to get around to it until now. So that those we discuss. But there's always lots of new things, and there's lots of things that are not really studied well at all. And lots of things are floated around on Reddit and other places, certain other people's channels, where they're just like, oh, I heard about this, let me try it on my head. So there's a lot of things out there that haven't been properly tested. So we'll try to cover as many as we can over time. Okay, so Shark Bait wants to know, would you recommend a lip lift before or after filler? Well, before, I mean, ideally, right? Because you don't want to have a lot of filler in your lips and then you're going in for surgery. How do you accurately determine how much to remove? It becomes difficult. So usually lip lift first, and then you see, do you still want some more plumpness after that? I recommend waiting about 3 months minimum before you then get some filler placed. So then ideally, lip lift first in that sequence. Sooner says, I'm glad you're doing this live. I'll get my question another time. Okay, cool. Let's see. Jenny wants to know, what's the best new treatment for acne scars and freckles? Can you get rid of them? Well, for acne scars, it depends on the type of scar, right? So if it's a fresher scar and it's not too deep, you might consider a scar gel even. And of course, and we have our own scar gel, feelconfident.com. That's our first skin product that we put out on the market. And we have like a cleanser, a moisturizer, and an HA serum that are coming soon. And they're really well made, very effective. So I can't wait to kind of show you guys and have you guys try it. So the scar gel you can use, right? If it's you don't want too old of a scar, and you don't want a scar that's like too fresh either, like a wound that's fresh, right? So you want a wound that's sealed up, and then ideally within 2 years of the scarring is when you should, you can use the scar gel. And other options would be sometimes laser treatments, sometimes chemical peels. And, you can also do like a surgical removal if it's a very deep, like ice pick scar. But yeah, we don't have like a million new like treatments for it, I would say. Just kind of the classic. There's microneedling, but I don't know. I'm not in love with microneedling on the face for scarring per se. But, some people use that modality. Okay, so Ryan. Never grew facial hair. Thoughts on FUE to form sideburns only? How would you terminate them on the face? Yeah, I mean, that's very possible. We do that, FUE to the sideburns. It's not a problem. The thing is, usually sideburns will consume about 200 or so, 200 to 300 grafts per side with FUE. And how do you terminate them? Well, they're designed with care. You have to kind of feather it a bit. You want to have a little bit of irregularity there at the bottom. But where exactly they end, we decide collectively. But that's, it's an option for some. I always remind people with any kind of facial, like eyebrow, beard, hair transplants, that the source of the hair is still coming from the same place, the back of the head. Meaning that the same hair that you would use for the scalp. So if someone's losing a lot of hair on the scalp and they also want a beard hair transplant, they have to realize that the donor area is limited, right? So you have to use your hair wisely over time. So that's something to keep in mind. Maybe one day we'll have cloning, but not yet. Not yet. There's also that whole Scoob 3 osteopontin stuff I was talking about for hair regrowth that we filmed today. It's all coming out of this one guy's lab out of UC Irvine, Dr. Plikis, and he's really kind of leading the way with a lot of this research. Not so much into cloning per se, but he's looking at ways of kind of stimulating hair. So someone who I'd like to talk to more in the future. And in that video, I also asked people if you want to, have them maybe come through for like a podcast. We were thinking of starting a podcast, right, to interview interesting people in the kind of aesthetics, hair, beauty, general space. So he, I think, would be a wonderful guest, someone really interesting to chat with. So if you want to see more of him or people like him on like a podcast with me, let us know. All right, Omar, do you recommend getting routine blood work done when on finasteride and or minoxidil oral medication? No, I don't recommend routine blood work just being on those medications. Philly boy, do you ever transplant hair below the frontalis muscle? So remember, the frontalis muscle, sorry, there's a little bit of sound in the hallway here. The frontalis muscle is running here. So when you say below the frontalis muscle, you're essentially talking about like eyebrows. So yeah, I mean, we do transplant the beard and areas like that. I'm not really quite sure if you mean like maybe where the frontalis muscle like ends, if we go beneath that. I know some people worry about, when you move your forehead, like maybe the grafts won't grow because you went too low. That's not really true. Like things will grow. Yeah, I mean, in terms of hairline design, there's a lot of factors there. We put out a video that I'm really proud of from about a month ago called How to Fix a Receding Hairline on the channel. And it really is like, I mean, we have to make the title catchy, but as far as like the details and the, I think, wealth of information in that video, there's a lot in there, right? In terms of like all the different features of just a natural hairline, and then how do I recreate that surgically. So I had a few patients recently come through the clinic like as consults, and they're like, I watched that video and that's the reason why I called you. Like the people who I'm looking to attract, if you will, as patients are people who really care about quality, and they're willing to, kind of spend a bit extra for quality work. I mean, we do one hair surgery a day at this point, and we put a lot of heart and soul. Just tell her to come back. Sorry, we just have someone knocking at the door. Oh, it's okay. I think they realized. And yeah, and those are the kinds of people who come through for actual surgeries. But I spend a lot of time putting together like education for people, and we enjoy that a lot. Yeah, sorry, veered off topic there, but that video is really useful, and I think to answer that person's question about the where we place the hairline, that video will give you all the answers. Let's see. Eddie wants to know, can I use a shaved head look after a hair transplant surgery? I ask in case I don't like the results of the transplant, but currently sport a bald head. Yes, you can, and that's why most guys are getting the FUE technique for harvesting grafts, right, from the back of the head. And that's because it's not going to really burn a bridge too much unless your FUE, clinic was not doing a great job with their harvesting. But usually with like one even larger procedure of say 2,500 grafts. Ooh, I sneeze. This is live, so you're seeing me and all the, kind of, this is the stuff that goes on when we film videos. We just cut it out, but this is real time Dr. Gary. What was I even answering? Zach, what was I answering?
Real-time Dr. Gary.
No, he's not even listening. Zach's supposed to be listening. He's not paying attention over here. I really don't remember. I lost my train of thought. Okay. Well, on to the next question. Oh, the shaved head. Yeah, so FUE is good in the sense that, you can shave your whole head and still look pretty normal. I mean, yeah, you can see little FUE scars, but you have to look pretty closely if it's harvested in the right way. With an FUT scar, you've got this linear scar along the back of your head. Now, there are some advantages to FUT, and we've talked about that in other videos, but for most guys, they really are choosing FUE. And so, yes, if you're unhappy with the density, let's say, that's created with one surgery and you don't really want to invest into another one, or there's just been like poor regrowth, yeah, you can still technically shave the whole head and likely look fine. Okay, so Jacqueline, thank you for the bless you. FF FXXR. Finessed rhino verse injections. Thoughts? Well, we do have a video on that. We have a video on all these things, right? Thank you guys for, for always supporting the channel. But yeah, we have video on non-surgical versus surgical rhinoplasty and the differences that, they create and when one can be used versus the other. The biggest thing to remember is with injectables on the nose, you're always like building, you're always like, it's augmentation, right? So you're making things bigger. But for many people who are looking to get a rhinoplasty, they're looking to get things smaller. So the only way to do that is with surgery, to remove things carefully or to trim things, slim things down carefully, where everything works well and looks good, but not necessarily like make things bigger, right? So keep that in mind. So like if you want to straighten the nose, yeah, there's some patients where if you inject some filler, up above the hump, maybe you'll make it look straighter, but you're still creating a bigger nose. And that's just not the right look for everybody. All right. Oh, this is about breast reduction. I'm going to pass on that. Bunch of Christina, I've lost a bunch of hair during weight loss. Been taking biotin since I noticed, not sure of effects. Is it likely to be permanent or a good chance of growing back? Any tips? Yeah, so weight loss, especially significant weight loss, can contribute to hair loss. Now, usually it does stabilize and return. It's like a telogen effluvium effect. So, right, there's a temporary shock and then it starts to come back. Biotin is unlikely to be a huge, contributor to success. It's probably just time. But you can also consider low-dose minoxidil, for example. That can sometimes help. PRP injections, laser light therapy, other medical therapies that we've talked about. And yeah, but chances are things will, start to normalize once the weight starts to normalize. Okay, Bratali. How long do you think I should maintain weight loss until I get skin removal surgery? I know maintaining is important, but what is a good amount of time in your opinion? I think in terms of having your weight be stable, it's good to maybe have it stable for at least like 3 months before you start to really, invest in surgery and go through that whole kind of surgical process, recovery, all of that. I think that's a good time period to aim for. Will you be posting, J-Lo, we got a J-Lo in the house. Will you be posting a video on facial contouring V-line surgery? Maybe, if you want to see it, I can, create a video about that. It's interesting to think about like, creating videos on things that I don't really do in the practice. And as I've moved away from lots of stuff currently, at least, other than hair surgery and lip surgery, it's been interesting thinking through the different types of material that we want to create. But yeah, I mean, I think we still should be covering some more nitty-gritty facial plastics topics. And and today we filmed, for example, a new type of segment on news, like the latest news related to aesthetics and plastic surgery, and we think you guys will like that. We're trying to push for like a quicker turnaround on that video, so maybe by Friday. So like this Wednesday, we're gonna post a video on the aging face filter from TikTok and my thoughts on that and my analysis of like different popular TikTok aging filter videos. And so Friday we're gonna maybe post the news one. And that will be cool. It's a lot of like relevant stuff to the time now. And then Sunday, hopefully Ryan Gosling, if the editors can get around to it. So we're actually trying to increase our overall production. So yeah, if there's videos you guys want to see, make sure to just put them in the comments. But also, you can just email. Like we have our email. I think it's what do we have in our YouTube thing? It's like the Dr. Linkov at Gmail, I think it is. But let's see. If you go to the about, what do we have there? I have so many email addresses I can't even keep track anymore. We have our info one, but no, there's another one. Details, business inquiries, view email address. Yeah. So drlinkovnyc@gmail.com. So just email ideas there if you'd like. Okay, let's keep going. We're 30 minutes into this thing. I think it's fun. I'm having fun. And sometimes I wish that some of you guys can just like jump in and I can like let you in with like audio, so we can do more of that type of stuff. But this is all just like text based, which a little weird for me because it's just like I'm just talking and I'm reading, but it's just me talking. Okay, so we've got Kazim, doctor, please help me with topical minoxidil for longer hair. I feel like drugs goes waste because of my long hair, and we don't have oral in our country. Please, doc. Well, yeah, so, many countries actually don't have oral minoxidil for some reason. I'm not really sure why. It's just like a generic drug, but hard to get in some places. And people reach out to us through the Feel Confident site, and they're like, "Oh, can you ship the minoxidil over to me in wherever, Australia or wherever, India?" And we're like, "We can't do that, because we can only prescribe within the United States." So it's a bummer that people can't get the medication. And so again, other medical therapies to stimulate hair growth could be PRP, platelet-rich plasma, low-level laser light therapy, microneedling. Those are some exosomes is something newer that's not FDA approved yet. We cover in, again, the video that we filmed today on the latest hair treatments for 2023. We covered the TED system from Alma. Alma is the company. TED is their ultrasound device, and some of my thoughts on that. So you'll see that video hopefully in the next 2 weeks. Sharu's vid edits have been immaculate lately. Thank you so much. I think everyone's working hard. We've got like 2 long form video editors. We might bring on a third one, and then we have a guy helping us with shorts. So, listen, it takes a village to get this stuff out to you guys. Some YouTubers, like, they'll do their own like editing and even their own filming and their own channel management, and I think that's amazing. But I have to run like a clinical practice that has like real people coming in as patients and real staff members working here, and it's I really think we're doing like world-class work in both hair and lip surgery, so I have to maintain that, and that's my top priority. YouTube for me is a secondary priority, but one that's still very important. And yeah, so I need help, and so the editors, and everyone else involved do a great job. All right, what else? Stephen Clark, what do you think about the side effects of oral minoxidil? Because in my country, doctors don't want to prescribe them because of low blood pressure side effects. Rarely see that, if any. I mean, again, it's about the dose, right? It's understanding which dose is effective for hair, but overall very safe. And we know those doses because we read the literature, and I prescribe it all the time to my patients. So yeah, we don't really have issues often. I mean, really ever. Like I don't remember the last patient I had to take off of minoxidil. Occasionally we'll dose adjust and bring the dose down, but the symptoms are usually like headaches or like slight lightheadedness, not like your blood pressure is tanking and you're doing terribly. It's usually very mild, if anything. Look, every medication has its more severe side effect risks, right? I mean, we all know that. But again, like, it's also doing some good for your hair, right? So you have to pick and choose like what matters more. Something that could potentially, in very rare instances, cause you, some harm versus something that, will just be consistently beneficial for your hair for years to come. So everyone's got to make that call. Some people will never take anything and they don't care what happens to their hair, but that's obviously not most of the people on this channel and most of the people coming to my practice. So yeah, you have to think about all that. Okay. Michael Crawford, I see you there, video editor. Thank you so much. We're looking actually at the third person who I mentioned for video editing. So yeah, just send us. I mean, if you've done YouTube before, we want people with some experience, especially with like in the education space. Yeah, send us your information to that email I said earlier that you can find on our channel. So okay. Let's see. Let's see who else we have here. Girl sitting in a tree. Okay. Cooch. What procedures are normally done for facial feminization surgery, particularly for transgender women? I love you so much. Thank you. Thank you. Yeah, I mean, there's different procedures to feminize the face. So everything from brow bone reduction and just resculpting the whole forehead to brow lifting to hairline work. So people who come to me looking to transition or in the process or whatever, they want a more feminine hairline. So we're rounding the hairline for those individuals. And lip lifts are very common as well. Reducing the philtrum, giving a more kind of pouty appearance is a more feminizing type of surgery. Let's see, what else? What are people saying? Zach, feel free to jump in if you see any interesting things. Okay. What else? What else? Looking for some interesting questions. Maybe he doesn't. What do I not know about? What are they saying? Something about moderators? I don't know. You're right. I probably don't know about them, but I'll take a look at the chat later. Let's see. Hairline, what should I do? I'm 21. Hairline started to get worse when I was 16, 17. Although past 8 months, it's been shedding like crazy. For the first time, having lost a lot of volume, was quoted 3,000, 3,500 grafts. Yeah, so again, Johan, the goal here is to first stop the shed. You should not get a hair transplant if you're actively shedding. I can repeat that. Do not get a hair transplant if you're actively shedding at any age. Any age. It has to be stabilized first, right? And that's where medical therapy comes in. And this is where people get really confused. And it's like a pretty simple concept, just stabilize the hair and then get surgery to augment the overall impact. It's not a good idea to go into, it's like you're going into a hostile, waters if you're trying to do a hair transplant when things are actively shedding, because you don't know what the final kind of pattern is going to be. So how do you even design hairlines? How do you design your recipient area if it's active shedding? You just don't know where it's going to stop. So not a good idea to jump into surgery during those times. What else? All right. What is your stance on taking daily Cialis to combat mild erectile dysfunction on finasteride? Look, I mean, I really, if someone has side effects, I recommend stopping the medication, finasteride in this case, waiting for things to return back to normal, which usually takes a few weeks. It can take months. And then resuming at a lower dose and usually a less frequent dose. I almost never recommend that people stay on finasteride. I never really recommend that. I mean, if they want to do that and take Cialis, that's up to them. I'm not gonna. What can I do if that's what they want to do? But that's never my official doctor recommendation. I tell people I don't want people walking around with side effects, obviously. So we take them off the pill, they feel better, and then we can resume at a lower dose, and usually people are fine. If that still doesn't work, we take them off, things get better, then we start a topical finasteride, usually like a 0.3%, and most people can tolerate that really well. Without side effects. Water break. Loading. What are your thoughts about face exercise and massage? Is it effective or bad? We have a video about like face gym and some of my thoughts there. I mean, I don't think they're bad. I just don't think they do a whole lot. I don't think we have good science behind that. And I just don't think they're super effective. But I also don't think that, you can maybe make an argument. Some people say that, well, with the exercises, could you be promoting aging because the muscles are working more and all this stuff? Hard to say. I can make an argument in both directions, but I really don't think it makes a massive difference. The biggest driver is always going to be genetics, whether it's hair loss or aging face. some people just have amazing genetics and some people, unfortunately don't. And of course, there are treatments and different things that can be done, but I'm not sure facial exercises are, should be a major part of the armamentarium. All right. Jetty D, have you ever had a person wake up during surgery? So the interesting thing is that most of my patients these days are awake for surgery, right? Because I'm mostly doing hair surgery and lip surgery. When I was doing rhinoplasties and facelifts more often, then yeah, I mean, we had patients who were asleep. I never had anyone like wake up after they had already been, sleeping. But for the awake surgeries, it's very interesting because they are awake, and so we need to keep them comfortable. It's local anesthesia. Sometimes we add in some Valium, some Ambien, and it's just about trying to keep people comfortable, Sometimes they have to adjust the position. You have to remember that, what you say, matters. Listen, sometimes surgery can get a little bit tense, right? Like on the technical side. And so I have to always remember to keep my, cool, and that my staff is very respectful, and also trying to do everything in their power to keep people comfortable, throughout the surgery. Some of the surgeries, lip surgeries are shorter, hair surgeries are long. And hair surgery is a very unusual because it's a long day. People are awake, but it is surgery, and they get a lunch break and they get bathroom breaks when they need and stretch breaks, and so there's really no other surgery that I know of that really incorporates all of that into like the actual day of surgery. So kind of cool in that way. So Happy Wife is asking, my single son is 30 and has a severely receded hairline. I have a ton of hair and would gladly donate. Is that possible? So it's not, because even though it's your son, his body will reject your hair. So it's really a kind gesture, but one that you shouldn't do. It can work technically with like identical twins because of the genetics. It can also potentially work if someone's on immunosuppressive medications, like let's say they have a kidney transplant, and then you decide, oh, like maybe they should get a hair transplant from someone else. It might work if they're on like rejection medications, which is not that common, and you don't want to be on anti-rejection medications just for hair. That would be silly, I think. Miriam, is it possible to have eyelid surgery just for one of the eyes? Yeah, I mean, it's possible, especially some people have like ptosis, right? So where there's a weakening of the eyelid muscle. And so there are, places that will offer some unilateral procedures for that. Usually ocular plastics would be the right subspecialty to go to. Okay. Sorry, Doc. Last question. What are all the options to hide a lip lift scar, including tattoo? For lip lift scars, if it's a hypertrophic scar, I recommend steroid injections until it flattens. Once it's flat, I usually recommend laser resurfacing, whether it's with an ablative laser or a non-ablative laser, depending on the skin type. And then, yeah, I mean, you could do some cosmetic tattooing beyond that. You can do some, I really don't like microneedling for lip lift scars because I find that there's a high tendency towards indentation or atrophy of the area. But usually all of that is enough to overall hide the scar pretty well. But again, my goal is for people to not really, most of my patients don't end up needing any lasers or anything. Things heal just generally really well. But I always try to underpromise the scarring and over-deliver, ideally. But there's only so much in my control, right? A lot of it also, well, some of it, I would say, depends on how the person cares for the incision post-op, and also just genetic factors involved with wound healing. People with really thick skin tend to be at a higher risk for hypertrophic scarring. Alex, is empty nose a result of turbinate reduction exclusively? Does Afrin use prior to surgery affect the risk of empty nose? So Afrin use doesn't necessarily affect the risk of empty nose, but surely turbinate reduction, but removal, which is what some people used to do and maybe even still do. That really is one of the main contributors to the whole empty nose phenomenon, where people feel like they can't breathe, but when you look into their nose with a camera, it's like wide open, but they still can't breathe, and it's because too much has been removed, right? Like the turbinates are there to provide laminar flow, to direct the airflow along the floor of the nose. If you remove that, then what you get is a lot of turbulent flow, and the brain just doesn't perceive proper airflow through the nose. So interesting. I do sometimes miss nasal surgery. I don't know. Maybe I'll make a comeback with that. We'll see. We'll see how things go, you know. But, you know, some of my patients are sad that I stopped doing rhinoplasty surgery. So we'll see what happens. Let's see here. Thoughts on retinoic acid for hair loss. This is interesting, Erica. In today's video, that same video I keep referencing that we filmed today, that 5 like latest hair loss treatments for 2023. Make sure to watch it when it comes out, because we cover tretinoin, which is the more potent, you know, prescription form of retinoic acid. We cover that and its impact on hair loss and specifically on androgenic alopecia, and sort of why, you know, it might be helping, and how it you know, works with minoxidil to maybe increase absorption. So definitely something to be on the lookout for, and I know it's been kind of a hot topic lately. Can you discuss topical finasteride dosing? What is a good low dose to start? Thomas, usually like a 0.3% is fairly common. Some people start even lower than that. Doctor, how do you distinguish types of hair loss? A lot of it comes down to the actual medical history and the patterns that I'm seeing. So the examination, or at least examination of photos and video, give a lot of information. Sometimes we have to do a biopsy, and sometimes there's some blood work involved. All right, guys, like 10 more minutes, and then I'm going to call it. Nick Smith, can you do a lip lift at the same time as an eyebrow hair transplant? So I don't like to do that on the same day. I'll usually ask for about a month apart, because of just the logistics of like the flow of the day. Because we don't want to, like, once we place the grafts, we want to be really careful, and we don't want to disturb them. And then also for the harvest of the hair for an eyebrow hair transplant, we need to be on the back of the head. So you're going to be face down. So if I do a lip lift, then you don't want to be face down on the lip. So usually about a month apart is how I would structure that. And I do both of those surgeries in the practice currently. What else? Do you have a wait list for consultations? I would love to have my lip lift done by you. Oh, thanks, Shark. I mean, it's not like a wait list. It's just like you just call in, just book the consultation. It's not necessarily a wait list. You just book it, and we'll chat with you. My wait times were really long for a while, because when we were offering all of the facial plastics and the hair surgery, and our channel, was growing pretty rapidly, it was kind of crazy. So wait times were nuts. And then we went up on our consult fee, and we went down on the overall offerings of surgeries, and that's really helped balance out the schedule. And I'm doing things I really enjoy. My team is like more focused than ever on the surgeries that we're actually doing, and people are getting great results. They're happy. And yeah, so I don't know. I'm really happy with the current flow of things in the practice. Okay, what else? We've got a little bit more time here. Miriam, no problem. Have you had a facelift yet? Abdul wants to know. No, I have not. I honestly have never had like any cosmetic work. I know sometimes people are like, oh, the lips, he must have had, like, no, these are, my mom has full lips, I have pretty full lips, I guess. Yeah, I don't know. And then sometimes people ask me, like, what about, well, what surgery would you get if you could get a, if you were to get a cosmetic surgery? I'd probably get like some filler or something under my eyes, the under eye hollow, because people like tell me, yeah, you look tired, all this stuff. And sometimes, I say, I am tired because I'm doing a lot of things. But and my daughter keeps waking me up in the middle of the night. But, there's just the reality of life. Uh, but yeah, but overall, I mean, I don't know. It doesn't bother me enough, like the under eye hollowing that I have, to be like, oh yeah, I'm gonna go jump in and do surgery. Because, I mean, you need time for recovery, and there's real risk and everything. So, I'm holding off. Maybe one day, But yeah, overall, I think I have pretty good skin, and yeah, I don't know. We'll see what happens over time. That actually, in the video that we're putting out on Wednesday, that the TikTok aging face filter reaction video of mine. So I actually did it to myself. So watch till the end of that video, because at the end I'm analyzing my own face, my own like aged face through the app, and the eye area is looking really gnarly. But I don't know. Maybe at that point I'll consider something. Uh, and all right. So what else? F. Austin, would you operate on your family members? The most I've done is like remove like a mole for my cousin, basically. Like, so yeah, I mean, if it's something that is like less completely cosmetic and a little bit more like a little more necessary, and they just kind of need to get it done, someone's got to do it. You know, if it's within my wheelhouse, I'll jump in. Um, but if it were like, I have colleagues who've done like facelifts on their wives and that kind of thing. I would never do that. I mean, the only reason to do it would be like to save money, and it's just not. That's not. I don't think that's a good idea, because there's just it's more involved and more things that can go wrong. And I think it's just a good idea. Let someone else do it. Dr. Gary, there's a doctor in my community who looks just like you. He and his daughter both have alopecia. Can you do a video on George Clooney's hair and Henry Cavill? Yeah, maybe we'll cover them eventually too. Oh, thanks, Kazim. Your eyes are not gnarly at all. Oh, Liz, my wife, Lily's watching and requesting a shout out. Shout out to my daughter, well, my wonderful wife, first and foremost, Liz. And so if you haven't seen her, she doesn't like to make these videos for YouTube. We've tried to get her on many times before, but she did do one video with me on Ozempic. So if you put in Ozempic and then whatever our channel, you'll see the video that I did with my amazing, beautiful, lovely wife, Liz. She's an internal medicine doctor, and we just covered the topic, I think, overall pretty well. And the video has like, I don't know, almost 2 million views or something. So people seem to like it. And I think a large part of that is because of her. So check that out. And then a big shout out to my amazing, beautiful, lovely, smart, awesome, best thing ever daughter, Liliana. It was her birthday just last week, and we celebrated at like a, I don't know, like a whatever kids place with her and her little friends this weekend, and that was really cool. So yeah, she's unbelievable, and she's like, is the one of the engines that keeps me going and doing this stuff. So just wanted to say shout out to you, Lily. So yeah, no, I'll be home for dinner soon. She probably wants to. She got so many little toys and from her birthday and wants to play with them, I'm sure. Okay. Any plastic surgery advice for 40? I mean, depends what you look like. I don't know. 40 can look very different on different people. Eye storm, so it's hard to say from just the text. Again, you guys probably have figured out my stance on plastic surgery, by now through all my videos, is that I don't think anyone, needs this stuff. I think, it's a good tool. It's a good thing to know about. when, sort of the time is right and when there's really something that's bothering you. But, even if someone, whatever, has a big nose, has small lips, has whatever, like, like a very thin area that looks like, it could use some filler, like, no one needs that stuff. It's just a combination of how you feel internally with like how, different possibilities that exist out there. So my job is to educate you guys on what's out there, what's safe, keep everyone safe as much as possible. And over time, we are going to be like suggesting different doctors and specific, providers, hopefully beyond just even cosmetic surgery, beyond that, because I think aesthetics is a very unique space. And I think it would be great to kind of like guide people towards the right places that really care about quality and doing things the right way, whether it's, here in New York or anywhere in the country or around the world. So that will be my next big push. Just kind of trusted places where people can go and feel like, they're likely going to get like a pretty good outcome. You can never guarantee anything, especially with cosmetic surgery, but you can set yourself up for success. Okay, so I think we are almost there. Okay, Kazim, thank you. Hugh, appearance is down to vanity. Yeah, but it's deeper than that. It's deeper than that. I know it seems like, oh, it's just your appearance, but it affects people in their daily lives, how they're viewed by others, how they view themselves. So it's a little more to it than just vanity. Okay, good. I think we're good. Thank you guys. All right, awesome. Thanks for explanation. Okay, good. Guys, thank you so much. Much more content to come. We're not slowing down. We're actually ramping up. So stay tuned, and thanks everyone for joining today. See you soon. Should I click it?